Hi, this is Hary from Physio, bringing you basic mobility exercises for the lumbar spine or the lower spine in today's video. Alright, so these exercises that I'm going to be showing or demonstrating are going to be useful for low back pain because of disc issues, because of arthritis. You could use it in every situation, but with a pinch of salt. As we go through the exercises, I'll tell you what exactly needs to be taken care of, and I think you'll be okay from there on. Alright? However, before we start these exercises, if you have been experiencing any lower limb or leg weakness because of your low back pain, or ever since your low back pain has started, or you have been experiencing loss of bladder and bowel control with your movements, I would strictly suggest not starting these exercises and going and seeing your local GP or your general practitioner before starting these exercises. So let's begin. Alright, for the first exercise that I'm going to be demonstrating, it's called as the spinal twist or rotations of the lower spine. All we need to do is have a lie down and twist our spine to one side. I'll show you how. So all we do is we have a lie down onto our back, bend one of our knees halfway to the chest. Use your opposite hand. So if you bend to your right knee, use your left hand on the top of your right knee and twist your spine to the left side. So while we are there, we hold it for 5 seconds and then gently return to neutral. I might then swap sides, do the same thing, completely the opposite way, and return slowly to neutral. For those of you who do have an ongoing hip issue and find this difficult, you could do the two-legged version where you could just keep both your knees bent and twist your legs gently or twist your knees, twist your spine basically one side to the other. The same precautions to the point of pain and holding each side for 5 seconds. Alright, for the second stretch, which is called as the buttock stretch or the figure 4 stretch, all we need to do is have a lie down onto our back with our knees bent. We just rest one ankle or one folded leg onto the other knee and pull that knee onto the chest with the help of our hands. Alright? We hold it there for 5 seconds. Gently come back down, swap sides. Now for those of us who cannot probably get our knee to the chest, it's absolutely alright to just have the leg rested and you feeling a stretch. All that matters is experiencing a stretch in that buttock zone and getting some mobility or getting that hip loosened out just so that it doesn't overload the already overloaded lower spine. Alright, for the third exercise, which is something to promote extension, lower spine extension or backward bending ability, to explain in simple words, which is again something that's lost with most low back pain problems or problems where you do have issues with your low back. A very simple drill called as the cobra pose or a backward bending drill in lying down. All we do is we have a lie down onto our tummy with the hands besides our chest, heads down, looking down at the floor. We gently lift our head up and then prop our body off the table and bring it down. We ensure that when we lift up and we go all the way, we don't lift our hips off the table. Alright, this is not a push-up. We could call this as a press-up. We're just pressing the chest and the tummy off the table. Alright? So, to sum it up, fourth and the final drill is something to facilitate your pelvis mobility. It's called as an angry cat, happy cat, or a cat-camel exercise. Choice is yours. All we do is we get onto our all fours like this. Okay? All we try to do is we try to tilt the hips up and tilting it down. So when we tilt it down, we look like an angry cat. When we tilt it up, we look like a happy cat. Alright? All we ensure is we look down to the floor, not completely down, but our eyes are down at the floor. Nothing else moves. It's just your hips tilting both ways. Do it gradually. Don't go too hard. Don't go too fast. Take about 2 or 3 seconds to go either way. As you're there, hold it for about 2 or 3 seconds and go the other way. Alright? So with all of these exercises that I discussed, I would probably encourage you to do it twice a day at least. What matters with all of these exercises is the frequency rather than the intensity. So don't go 500 repetitions and you're done. Now, I probably do about 10 repeats of all of these exercises with a 2 to 3 second hold in the morning, 10 repeats of 2 to 3 seconds hold in the night. One of the best ways I talk to my clients is maybe think about doing it before you get out of bed and while you're getting into bed. Yeah, and if you can have maybe another session or a couple of sessions throughout the day, that's a bonus. Right? So I hope these exercises as always have been useful. See how you go. But if you do need our help, we're still open during all of these restrictions that we're experiencing in Victoria. We're still open. We're maintaining all the necessary precautions just to avoid any transmission of any problems. So do give us a call if you think you're still not able to get hold or catch hold of your problem. I'm more than happy to help. Alright? Thank you.